Hello, my name is Madhav Pinduria,
And my name is Manthan Patel.
and we are going to give a PACE presentation on the topic of diabetes and particularly dietary aspect of diabetes. Diabetes is a situation in which the body is not either able to produce insulin or sometimes the body is not able to use insulin in the sufficient amount, and due to this the blood sugar level rises, and due to this the level rises, and imbalance of insulin and sugar level is uh, like sugar level becomes appearance in the bloodstream. Basically insulin is a hormone which is produced by the which is produced in pancreas of our body, specifically isolate of Langerhans cells of pancreas, or the beta cells of pancreas produces this hormone, and it controls the blood sugar level of our body. Diabetes it is a major chronic disease which is affecting the people who are in the obesity range, or who are obese, or who have high blood pressure, or some other reasons like they are not active and all those things.
Risk factor for the diabetes. There are two type of diabetics. Type 1 diabetics, family history and aging factor are key roles. And for type 2 diabetes, pre-diabetic, overweight or obese, age also is key role. Are an African, Hispanic and or Latino, American Indian and Alaska Native persons, blood pressure or high cholesterol, and for both diabetes, physical inactivities also play key roles. Nutrition recommendation and intervention for diabetes. Fat and calories should be reduced in diabetes with the regular physical activity. Person have to do physical activity 150 minutes per week. High fiber food is recommended for the diet plan, which helps to reduce the glycemia in subject with the type 1 diabetes and glycemia and lipemia in subject of type 2 diabetes. Fiber rich foods includes legume, whole grain food, fruit and vegetables. Diabetic patients have to intake 1 4 gram per 1000 kilocalorie. Protein intake should be greater than 0.8 gram per kg per day for the diabetic patient, and usually not exceed 20% of energy intake, because in long term effect on kidney function for patient with the diabetic. Dietary pattern that include carbohydrate from the fruit, legume, vegetable, whole grain food and low fat milk. Alcohol-based sweeteners such as mannitol, sorbitol are used for the diabetic patient because it has only 2 calories per gram.
Article 2: Dietary and nutritional approaches for prevention and management of type 2 diabetes. Like in earlier times, there were researches were conducted, and due to this, there was more emphasis put on the low fat diet. But nowadays, more and more studies are conducted, and due to this, nowadays they have started to focus more on the quality and quantity of macronutrient the diabetic person is consuming, and not on the low fat diet or low caloric diet. They also say that they need to manage the medication doses for type 2 diabetes people according to their dietary intervention, which are suggested to them by doctors or the dietitians. One other very important factor for prevention of diabetes is weight management, because mostly type 2 diabetes people are those who are obese, and due to this they are easily susceptible to diabetes nowadays. Like Canadian guidelines recommends to have 40 to 60% of total energy in form of carbohydrate, only 10 to 20% of energy is in the form of protein, and less than 35% as fat. But on the contrast, Indian guidelines suggest that you need to have 50 to 60% of your energy from carbohydrates, only 10 to 15% from protein, and less than 30% from fat. Studies have shown that dairy products are very useful in the management of diabetes because like they provide some of the necessary essential macronutrients and proteins and other vitamins also that can help diabetic people in the way of dietary part of their like diet. Article 3, facts about natural and artificial sugars. So there are basically three types of sweeteners or sugars. One is the natural sugar, then modified sugar, and the artificial sweeteners. Added sugars or the natural sugars are sugars which have high caloric value compared to the other two types of sugar, and they should be avoided if you have type 2 diabetes, as it can have various complications. And like the added sugars, they have 24 grams. So the woman cannot have more than 24 grams of sugar per day, while male can have 36 grams of sugar per day. Processed or ready-made food should be avoided by the patients who are having diabetes or who are obese, because these foods contain a high amount of sugar, and this can contribute to to complications like obesity or heart-related diseases. Then modified natural sugars. Modified natural sugars modified natural sugars should be avoided, as it can have complications in terms of like the sugar level, but they are having low caloric values compared to the natural or added sugars. But these are the sugars which raise your blood sugar level, but they don't get absorbed in the body completely. So it can be consumed in case of like avoiding the added sugar. But if you are looking for the no caloric sugar, then you should go for artificial sweeteners. They are considered boon or like a blessing for the diabetic people, because these are the sugars, they don't raise your blood sugar level, they make the food to taste sweet, and they don't have any caloric value, so you can consume it and it won't contribute to your caloric values or the energy values. Some examples of artificial sugars are aspartame and saccharin. Extra added sugars are not good, as it contains extra calories which can lead to obesity, so we should consume added sugar wisely. Thank you. And here are the three articles which we have used to these are all the peer reviewed articles and which we have used to do our presentation. Thank you.